Hello, everyone, and welcome to today's webinar. Today's webinar will be talking about the role of nurses in supporting breastfeeding and building sustainable support system. My name is Joanne Basweti. I'm a neonatal nurse with 15 years experience working with neonates. I work in the newborn unit at KNH Kenya, and I will be your moderator. Thank you for joining us today to explore the role of a nurse in supporting breastfeeding and building sustainable support systems. Kindly inbox, just to know where you're coming from, kindly inbox where you're listening from, your country, and probably your role in supporting breastfeeding. I'll be glad to see the chat and the inbox. So the relevance actually for the reason as to why we're going through this session is because breast milk is very key in promoting health and support of the neonates and infants. And this basically supports the development of the babies. So I'd like to see the countries you're listening from, probably the counties. If you're working in Kenya, I'll be glad to see which county you're coming from. Thank you very much. I can see Stella from Kisumu, Timothy, Nairobi County, Bomet, well represented, Uasin Gishu, Nairobi, Migori County, Machakos, Nairobi. Thank you very much. We are really privileged to have you around with us. For purposes of housekeeping, before we begin, I'd like to point out that this webinar is being recorded. The session will take approximately 1.5 hours, and we will have a question and answer session at the end of the session. If you have any question or comment, feel free to type in the chat box throughout the presentation. We are excited to have you here today, and we hope you'll find this session informative and engaging. Today, I'm glad to introduce our presenter, Madam Makena Kinoti Ringera. She's a senior nurse working at KNH Newborn Unit. She's a neonatal critical care nurse, very passionate with babies, and she really plays a key role in promoting breastfeeding in the newborn unit at KNH Kenya. Welcome, Madam Kinoti.
Thank you. Good afternoon. Like you've heard, my name is Makena. So today we are going to go through our topic for today is our nurses' role in building sustainable breastfeeding support system. So we need to come up with ways for us to be able to support our mothers on how to exclusively breastfeed and even beyond 6 months of breastfeeding. So if you have any questions, we'll have a question session later. But if you feel like the way Basweti has said, feel free to type in. So, for our introduction, we see that breastfeeding is a natural and unique system of supply and demand, which best serves both the mother and the baby. It's one of the most effective ways to ensure child health and survival. Now, according to WHO and UNICEF, it recommends that these units initiate breastfeeding within the first hour of birth and exclusively breastfeed for the first 6 months. You can also add to that breastfeeding, it is an eco-friendly way of sustaining our environment. So it is better for us to know the benefits of this breastfeeding because it is a provision for energy, for nutrients for these infants, and there is a need for the first of months of their life to have this breast milk, and even up to the second year of life. Also, it is a safe and cheap and readily available on demand. It gives our babies better intelligence, brain-wise, the brain cells they develop well. And then there is a reduced risk of overweight and obesity, and diabetes rated rate in these babies. And also there are researches that have shown us that there is a reduced risk of breast and ovarian cancer. So you see, breastfeeding, it is both very important for the mother and for the baby. So I want us to dig deep to statistics to show how important we need to sustain our breastfeeding. You find in 2022, the Kenya Demographic and Health Survey showed that every 41 children who die before the age of 5, 26 die in the first month of life. Then this makes an early action like breastfeeding an extremely important endeavor to do. Among these, we lose 4.8 million children under 5 globally every year, and out of the 4.8 million, 2.5 millions are neonates. You can see it's a big number. Babies who are aged 0 to 28 days make up 47% of all deaths of children under 5. Therefore, optimal breastfeeding contributes to up to 12% of deaths among the under 5, while breastfeeding in the first 1 hour after delivery will save 33% of this newborn. You can see through our statistics how it is very important for us to advocate for breastfeeding. So early initiation to breastfeeding also drops. It has drops from 61 from 63. You see from our previous statistics of 2014 to 2022, there is a drop whereby bottle feeding was recorded to have increased from 26 to 34. So you can see most of the people are opting for bottle feeding instead of breastfeeding, of which this calls for us to advocate more on breastfeeding. In 2022, the Kenya Health Survey showed that 60% of the babies under 6 months get only breast milk, and 60% of newborns are breastfed within the first hour of life. Let me sample some of the counties in Kenya. You find in Nakuru, they only managed to breastfeed 41%. In Kisii County, they only managed to breastfeed 33%, while in Nairobi, despite being a metropolitan, 67% are able to breastfeed. These are some of the counties that we are able to sample. Other counties, we are here to get more data on that. Now, I want us to have a look at this table. You can see it's about initiation of breastfeeding within 1 hour of delivery. You can see mothers with vaginal birth, they are at a greater percentage of 65%, while the mothers who underwent cesarean section, we are at 34%. Actually, it is literally like half of the vaginal deliveries. To get into that more, mothers in the rural areas, we are at 63%, while the mothers who are at urban areas, we are at 55%. So it's not a marked difference, but it shows us that we need to pull up our socks when it comes to advocating more on breastfeeding. Now, when we look at indicators for 2014 to versus 2022, like we have done earlier, we have seen that initiation of breastfeeding within 1 hour, we are at 63 in 2020, 62 in 2014, while in 2022 we are at 60. So it's a slight difference, but it is a difference of 2022. We are literally we are at a lower percentage as compared to 2014. Well, for mothers who are exclusively breastfeeding below 6 months babies, in 2014, we are 61, while in 2022, we are 60. For exclusive breastfeeding for less than 1 month, we are at 77. And then for exclusive breastfeeding for 4th to 5th month before you wean the baby, at 2014, you can see we are at 42%, while in 2022, we are at 38%. And then for continued breastfeeding beyond the 6 months up to 2 years, you can see in 2014, we are at 75, while in 2022, we are at 65. Ever breastfed baby, 99% in 2014, while 98 in 20, a slight difference. And then for bottle feeding, you can see there is an increased percentage of bottle feeding, whereby 2014 versus 2016, we are at 22 and 34 respectively. So we can see we are on a downward spiral instead of an upward spiral. Now, despite us being on a downward spiral, I guess it is time for us nurses, and not only nurses, all healthcare practitioners, because when it comes to health system, it is a multidisciplinary. For us today, we are going to tackle the role of a nurse in breastfeeding. And the first key point is that we start out right from antenatal, right from rebound. So the first hours and days after birth are one of the riskiest period. Early breastfeeding provides babies with powerful line of defense. Well, therefore, we say nurses play a big role in helping mothers begin breastfeeding and to enjoy it. So you can see you as a nurse who is in rebound, postnatal, antenatal, you have the token to make sure that this mother is breastfeeding, is able to breastfeed, and also to enjoy this breastfeeding. For prenatal nurses, these are nurses who are in the antenatal ward or in the clinics. The first role is to sensitize the mother's on advantages of breastfeeding to the mother and babies. Don't assume this mother has 3 babies. She knows what it entails. Just assume this mother doesn't know, and sensitize on the advantages, the nutritional advantages, the infection prevention. Then you need to allay the anxiety that come up with possible breastfeeding. Maybe this mother, the previous pregnancy, she didn't have enough milk, or she was feeling pain while breastfeeding. Allay this anxiety, and then sensitize on boarding, that this mother is able to board more with the baby. And then we build confidence on proper positioning and latching technique. Most of the hospitals right now, we have mannequins that we sensitize the mother before delivery on how to position, on how to latch. These are very important steps that you as a prenatal nurse, you need to sensitize the mother on. So when the mother goes to the labor ward for delivery, at least she has the know-how. But no, it doesn't end there. We need to look at when this mother comes to the labor ward or in the delivery couch, what does the labor and delivery nurse do? So you as the labor and delivery nurse, you support the mother on early skin-to-skin contact. Therefore, these will stimulate breastfeeding and boarding. It is very important because once the baby is born, that skin-to-skin contact enables the baby. The sense is now the baby starts to want to breastfeed, and then assist in initiating latching and positioning. Just don't deliver in the mother and leave the baby. Just assist the mother on how to latch and how to position. Take time with this mother. Appraise the mother who has had cesarean birth or premature birth, or as a sick infant. Maybe this mother is seeing the mother who is sleeping next to her, that she is breastfeeding and her baby is in newborn. It's going to appraise the mother that it is okay, even if the baby is a sick baby or a premature baby, we can still achieve that breastfeeding. Now, if this mother goes to the postnatal ward, what does the postnatal nurse do? Let's go through that. The postpartum nurse, that is in our postnatal wards, providing frequent maternal-infant contact to establish and maintain milk supply. Don't focus more on the mother, checking the cesarean site or if the rocky is right. It's going to take time. Make sure the mother is rushing the baby well. How is the contact? Maybe the mother is going through period depression. She doesn't know how to do it. It's going to frequently check and then address any breastfeeding challenges like sore nipples, engorgement, and low milk supply. Maybe on this point, I would want us to type down in the comments, what are some of the things that you do to tackle sore nipples and engorgement and low milk supply. We'll go through them later. And then it is going to monitor and support the frequency. Maybe this mother breastfed in the morning, you have come for your afternoon shift and the mother has not checked on the baby because the baby is sleeping. It's going to check on the weight gain. I don't know if our postnatal ones, we are able to check the baby's weight, if you are gaining weight or you are losing weight. And then the maternal well-being. How is the mother feeding? How is the mother socioeconomic status? How are the family supporting her? It's going to check on the mother's well-being. And then referral for lactation specialist. Maybe this mother has a low milk supply, is going to, for example, refer to a nutritionist for added advice on that. And then advocacy for breastfeeding policy. This is a challenge that mostly we find in the postnatal and even labor ward, whereby the baby is crying, you just give formula for the baby to be quiet. Are we advocating for these breastfeeding policies that are instilled in our institutions? Are we supporting the mothers to recognize and respond to their infants' schools and feeding? So it is good, the frequency on how we check on our mothers and to educate them, it is a continued thing that we need to be doing in our postnatal and even to the rest of the ones. Now, supposing this baby is in NICU, supposing this baby is in ICU or is in our newborn unit, first of all, we'll support breastfeeding. Maybe this baby is admitted because of neonatal jaundice. We can still support breastfeeding. Don't tell the mother that because the baby is in NICU, we cannot breastfeed. It is good also in newborn to always look for loopholes on how we can support this breastfeeding. And then emotional support. Remember, this mother came to the hospital knowing she's coming to deliver and go home. But now the baby is in a new nursery, she can't understand the new environment. It is going to emotionally support them, reassure them, build confidence on. She can also continue breastfeeding here. And then advocacy, monitoring and assessment. Still, we continue on weight gain, feeding frequency. Here in my facility, we do 3-hour feeding. So I don't know from other facilities all over how frequent you monitor your feeds. And then the amount, there is that amount the baby is supposed to get every 3 hours or every 24 hours. And then remember, it is a multidisciplinary collaboration. You cannot work alone. It is a coordinated approach to breastfeed, whereby it involves the mother, it involves you as the nurse or the doctor or the nutritionist, and then documentation and record keeping, very important. Remember, for us to get these demographics, we need record keeping. It is going to record if the mother is breastfeeding well, how frequent is she doing, how many mothers are breastfeeding in your facility. So it is good for this record keeping and documentation to occur. Now, I'm going to tackle, because this nurse is working at a facility. So we are going to see, what does the institution play a role, how do they play a role in ensuring that breastfeeding is occurring? So in our facilities, either in referrals or the county levels or the health centers or the private sectors, what role do they play? So we need adequate budgets and integration of services for crucial delivery of appropriate breastfeeding care. Remember, the Employers Cup 2017 indicated that it is very important for every facility to play a role in ensuring that breastfeeding is taking place according to the recommendations of WHO. So we need a supportive infrastructure to allow rooming in for the mother and the infant diet. That comes to my concern. Rooming in, it requires the mother to be comfortable and for the infant to be comfortable. So in a situation whereby the mother is not in a position to room in, then it becomes a challenge. So in a facility whereby maybe the patient is having their own bed, is having their own room, their own privacy, then it promotes rooming in. And then there is the implementation and monitoring of breastfeeding and supportive policies and programs for quality care. We need routine monitoring of policies and programs to include evaluation of breastfeeding outcomes and their measurable targets. So that is where research comes in. We see what is causing these challenges, what can we do better? So it is good to have these measurable targets for us to be able to improve our percentage, and then allocate adequate staffing levels to ensure adequate time for supporting mothers and infants. Remember, if it's only one nurse who is in postnatal versus 50 mothers who have delivered, because of that shortage, definitely this nurse is able to prioritize on the cases that require attention. So it is appropriate for facilities to have adequate staffing levels and also to train the healthcare providers on lactation management. Most of us, we have read about breastfeeding, but do we know do we have the competency? Are we being put to terms with retest updates? So it is very important for facilities to train their healthcare workers. Remember in 2017 also, that Health Act said that every facility should have a lactation room. So as the facilities work on staffing, work on building infrastructure, it is very important for them to have a lactation room. It is very also important because we have staffs who are working in these facilities, but they have breastfeeding babies, they are breastfeeding babies. So according to that Health Act 2017, it also instructs that the female employees, they need to go for maternity leave, and even for the men also to go for a paternity leave of 2 weeks. So with that, we improve on our breastfeeding. So what does the Ministry of Health, because they are the policy makers, remember, it is a multidisciplinary, we cannot work. I want us to go through some of the policy makers, what the roles that they can play, they can play in this to ensure that we are improving on our breastfeeding. Okay, for the policy makers, that is the Ministry of Health. I know for every country, for every county, they have a Ministry of Health, and nationwide, we have that Ministry of Health. So it is good for these policymakers to invest in healthcare facilities to sustainably improve breastfeeding rate, fully integrate critical competence into pre-service training and continuing education of all healthcare practitioners. So this is where the release now, whereby you are told maybe to work for a certain period and then you go for training. And then we need funds and develop a comprehensive specialized training for healthcare workers to enable them to address complex breastfeeding situation. Then we fully integrate quality and respectable maternal and newborn care as stated in the global standards of baby-friendly and Kenya Breastfeeding Parliamentary Bill 8 of 2024. And then we need to strengthen the leadership role of the healthcare personnel at national, local, and facility levels in breastfeeding. So you see, this is very important because for such facilities to be able to work, they need the Ministry of Health. For the facility to be able to, for the nurses to be able to play a role, they need the facility and the, so it's a multidisciplinary. Now, I want us to go to the role of the family. Mostly for the family, it's psychosocial and financial support. Remember, this mother requires, she's at a very critical stage. And in order for the family, the support system is the family. So it is good for the family to psychosocially and financially support this mother. So ensuring that the mother is eating a balanced diet, hydrated, and is rested. For some facilities, they don't allow food from outside. So that is where now it plays a key role that serve patient with a balanced diet. Remember, a patient who is diabetic and a patient who is breastfeeding, their diet, they are totally different. And then help the infant be positioned correctly in the breast. It's not only the healthcare workers, even the families, they play a key role. And then further skin to skin. Remember, this baby requires to strengthen their infant skin defenses. So it is very appropriate also to encourage the family to do this further skin to skin, and then they need to own the decision to breastfeed. You cannot force a mother to breastfeed. Remember, it is a own endeavor. So I also want to add to this that it is good helping the mother with a pillow and poppy placement, and then a pillow. There is the breastfeeding pillow, and then the poppy placement. I don't know if, please share in the comments if you do that at your facility. Okay, so next I want us to tackle challenges and limitations that we might occur, because it's not a bed of roses anyway. So let us go through some of the challenges. The first challenges and limitation, there is increased morbidity and mortality. Infections like acute kidney injuries, shortage of, you realize that if during our statistics, we saw that the percentages that are they are coming down. So it shows that most of our babies are not breastfeeding. So there is an increased risk of infection and kidney injury. Most of our babies, they come back to the hospital because of dehydration. Then there is shortage of health practitioners, nurses, nutritionists, even dietitians, doctors. There is always a shortage of that. And then there are surgical conditions that may challenge us, like maybe the mother I went through mastectomy because of other conditions like cancer. And then there are medical conditions like breast cancer, or if the mother is on chemoradiotherapy. And then we have HIV and active tuberculosis. So these are some of the challenges that they pose on breastfeeding. So I want us to internalize on those limitations before we move on. Okay, we can move on. So the other conditions that may hinder breastfeeding, whereby we have infant condition like inborn metabolic failures. So if a baby has inborn metabolic failures, then we cannot breastfeed. We have to do lactose-free things. And then there are lifestyle factors whereby the mother chooses not to breastfeed for cosmetic reasons or also work. And then we have social norms and cultural belief. This one I'm quite interested to know some of the social norms and cultural beliefs that might hinder, but there are whereby you find that because of customary taboos, breastfeeding then it's hindered. Please share in the comment section some of the cultural norms that you have encountered when you are advocating for breastfeeding. There is personal preference whereby a mother chooses not to breastfeed but to bottle feed. And then pain and discomfort, which is a personal preference also. The mother doesn't want to go through that pain and discomfort of breastfeeding. And then if you have insufficient milk supply, then we have a challenge in breastfeeding. So as we internalize on these points, I want us to think of some of ways to better our breastfeeding, how we can better support breastfeeding, and please share. So what do we need to do better to support breastfeeding? Okay, remember breastfeeding, it's not always easy, but it is worth it. It's never easy, but it is worth it. So WHO came up with the Baby Friendly Initiative. This is what we use to advocate for breastfeeding. It was established in 1991 to help motivate facilities providing maternal and newborn services worldwide to implement the 10 steps to successful breastfeeding. In 2018, WHO revised the 10 steps based on 2017 guidelines on protecting, promoting, and supporting breastfeeding, of which that is our theme for this year: to protect, to promote, and to support. So we will go through these 10 steps. So they are subdivided in two sections. We have the critical management procedures, and then we have the key clinical practices, whereby our first step is comply fully with the International Code of Marketing of Breast Milk Substitute and relevant World Health Assembly relations, and then ensure that the staff have sufficient knowledge, competence, and skills to support breastfeeding. This is whereby it is medically not indicated, then it allows for that. And then for every facility to have a written infant feeding policy that is routinely communicated to the staff and parents. So for every facility should have that policy, maybe through CMEs and trainings, to be communicated to the staffs and parents. And then we establish an ongoing monitoring and data management system. So under the critical management, under those 2 points, that is very important. So for our third step, we discuss the importance of management of breastfeeding with pregnant women and their family. If you remember well, in our previous trains, we saw that it is something that starts from the antenatal, from the clinic, the antenatal clinic, whereby we discuss the importance of management of breastfeeding in pregnant women right before even they give birth. And then for the fourth step, we facilitate immediate and uninterrupted skin-to-skin contact and support mothers to initiate breastfeeding as soon as possible after birth. So we have the golden minute, the golden hour, whereby we initiate that skin-to-skin, and then support mothers to initiate and maintain breastfeeding and manage common difficulties. You can see these are steps that are attainable. These are steps that we are already doing. We just need to pull up on our socks. And then do not provide breastfed newborns any food or feed other than breast milk unless medically indicated. Please don't rush to give formula feeds, or don't rush to say this baby is not getting enough. Let me give 10% oral. Enable the mothers and their infant to remain together and to practice roaming in 24 hours a day. I don't think there is any facility that delivers a mother and discharges immediately. It is going to encourage roaming in 24 hours a day. So this mother stays with this baby. Remember their boarding also. Then support mothers to recognize and respond to their infant calls for breastfeeding. So when you put a finger on the cheek, the baby moves or the baby is trying to cry. Those are cause for feeding, among others. And then counsel mothers on the use and risk of feeding bottles, teats, and pacifiers. So instruct them, counsel them, not instruct, I'm sorry, counsel them on the risk of feeding bottles. We need to know, are there any facilities that are encouraging feeding bottles and pacifiers? And then coordinate discharge so that the parents and their infant have timely access to ongoing support and care. This is where by now we come in on discharge. The earlier we do the discharge for these mothers to be together with their families, the better. So we coordinate a discharge process. Okay, are there any questions and answers? This ends our session, but we are open for questions and answers. Thank you.
Thank you very much, Makena Kinoti, for the good job. Thank you for the presentation. We truly appreciate the presentation. So I'll now like to open the floor for questions and answer. And I can see there's an anonymous attendee who is saying, we appreciate the session. We are learning a lot. However, personally, I have not been receiving the CPD points. That one, I think we'll sort it out. So there's Jacqueline. I think increasing the maternity leave and ensuring it's paid, whether a business owner or in unemployment, there are women who go back to work at 6 weeks and even 2 weeks. Also increasing the paternity leave to 3 months and paid. This encourages a sustainable support system. Thank you very much, Jackie, for that comment. So there's a question here from Anne. How does breastfeeding help in preventing a woman from developing breast and ovarian cancer? Go. Okay, so we'll be answering that in a few. Please talk about HIV and breastfeeding. We'll talk about it. Then there's a question here, how they manage cracked nipples. So far, those are the questions that we have. Keep sending your questions in the chat box as we answer you now. Makena?
Okay, I'll start with the first question of diet. Someone asked what's a diet. A diet is actually an English name that requires, it says it's a two element. It's like it's an element, two people as one. So the mother and the infant, they are one. It's two elements that it's making one. I'll answer the question concerning HIV and active TB, whereby the viral load it's a bit high, then breastfeeding becomes a challenge because you have to take care of the viral load. So there is where now the mother is cancelled of either doing feeding the donor milk as the viral load is being tackled. For the active tuberculosis, definitely you don't want. We also need to tackle for the tuberculosis before feeding. So that is why we said it's a challenge because of the viral load. And for the active TB, we manage the TB, then breastfeeding. So meanwhile, as we manage that, please note, we don't do formula, we do donor milk. But for most of the facilities, I know that will come up. We don't have the milk bank. So it's one of the challenges. Okay, I will tackle the question on cracked nipples. Actually, this was a question that I had drawn to the group, but different facilities and different people tackle cracked nipples differently. They tackle differently. There are some facilities, there is a cream that is normally applied to tackle that. Meanwhile, the mother can express and give breast milk. Still, we don't advocate for formula milk. So for the cracked nipples, as it's being managed, let the mother express and give the baby as you await for the nipples to resolve. Okay, there is someone here who has said breastfeeding in mpox situation, Tangara. So for mpox, breastfeeding requires a careful assessment. So for this case, it's a case-to-case assessment whereby now you have to involve the infectious disease department to know if it is safe, or we need to have the donor milk for that. Someone asked, how does chocolate help in breastfeeding mothers, if any, the effect of sour porridge in milk production? Now, it all retrogresses to hydrating the mother. You find for coffee, the mother cannot take caffeine. So it is more about hydration. Sammy says, what are the disadvantages of use of NAN? Does it cause gut inflammation, low immunity on children? Well, that's a good question. NAN, I'm assuming that is formula because it can vary from NAN to other brands. So the disadvantage is actually for formula milk, it has all the nutrients that the baby requires, but the disadvantage of it, we don't have the antibodies that the baby requires to build on the immunity, which the mother passes on to the baby through breast milk. Also, for formula milk, because of those nutrients that are set for this baby, they can inflame the gut. So it is a careful endeavor to give formula. So it is likely to cause inflammation, and obviously the formula doesn't give immunity, breast milk does. And then Anonymous says, a healthcare worker, we should extend the same care we offer to ourselves. When we recommend breastfeeding up to 2 years, we should give breastfeeding colleagues their duties only for 2 years. Why is it that breastfeeding rate are going down of late? Thank you for the nice presentation. Thank you. All right. What is donor milk? Donor milk is whereby we have a facility like in Kenya, that is Pumwani Hospital, whereby we have a milk bank whereby mothers express their milk. It is taken through screening And then after the screening, that milk, it is safe to be given to other babies whose the mother is not able to give breast milk. So that is donor milk. It's from other mothers, but it is screened.
Thank you. Thank you very much, McKenna, for the answering or responding to the questions. Thank you to the attendees. Good job, particularly on the statistics presented. The drop is an increasing researchable aspect to explore since breastfeeding has been widely advocated and healthcare workers, particularly nurses and nutritionists, have done a fantastic job on it. Maybe you may give your views. I agree with you. The statistics are real, Joseph. And actually, to respond to this, this is an eye-opener to us. When we have these real statistics, it's an eye-opener for us to really research more and even pull up our socks in terms of supporting these mothers. How do we, if like, for instance, I bring in a simple scenario where a mother brings in a drop of breast milk. How do we respond to that as healthcare providers? Do we respond in a harsh way? Do we encourage them? So truly speaking, this is a wake-up call to all the healthcare providers to support these mothers. Because remember, I can imagine a mother who is struggling to express and they bring in 2 drops of milk. Many a times we will like push them off and we are like, we don't appreciate them. But it's possible for us to support them, encourage them, appreciate that drop of milk, and it can go a great mile. There's a question here. What type of formula milk will be ideal for babies who have challenges with milk production?
Since we are advocating for breastfeeding, I cannot answer that what best breast milk. It is going to refer. If this mother truly cannot get donor milk and the only choice is formula, then that is when we refer to a nutritionist to advise on the best formula. So I have no preference. I guess it's a personal preference also.
Thank you for that. Sami Rotich, do you recommend the formula to be administered at a controlled amount?
Do you recommend the formula to be administered at a controlled amount?
Or should mothers avoid it completely?
The mothers should avoid. Remember, when you do mixed feeding, whereby you are doing breastfeeding and formula feeding, you increase chances of this baby developing GIT issues. So it is always good to recommend to completely avoid it. Remember, you as the healthcare worker, you know the advantages of just breastfeeding, of giving breast milk. It is good to at least recommend for this mother to avoid this formula. But if this mother is still advocating to go on with formula, then also there is a recommended amount for every inch, day, and weight.
Thank you for that. If there are no other questions, we appreciate the questions. Just to wrap up and probably revisit our key take-homes or takeaways, we can see that breastfeeding is very key for the mothers and the babies. And of course, despite the challenges that we are facing and the limitations that are there, I believe we can overcome the challenges by just working together, team up together and support these mothers, introduce family-centered care, have them the next of kin support even in feeds, as McKenna has clearly mentioned. And this truly can help the mother and of course, reduce the mortality rates. The other thing again is breast milk, when breast milk is initiated within the first 1 hour, this can reduce the mortality rate and save around 33%. So I think this is a wake-up call to the team in labor ward and maternity theater to ensure that they initiate breastfeeding immediately within the first hour, because we have seen through evidence that this one will reduce on the mortality rate for the neonates. Because remember, again, when we look at statistics, when we look at the under fives, the highest level of mortalities are from the neonates. So if we can support them at an early tender stage, then it's possible for us to even achieve our targets. Then I'm glad with the statistics, because this one has really opened up our eyes, and we can see where we are. And I think it's us to wake up and work together, put our heads together, the nutritionists, doctors, nurses, and all the people, the management level, to support and ensure that we improve. It's so funny, and probably can just pose a question to the team. From the statistics that were shared, you realize that the mothers in the urban areas who are breastfeeding scored the lowest. They were at around 34, I guess. The ones in the rural areas were at around 61. What could be the reason behind that? I'll be glad to see your comments on that. Why is it the mothers in the rural areas breastfeed their babies better or more than the ones in the urban centers? I'll be glad to see your comments on the same. Then the other thing now is appreciating the role of the nurses. We really have a role there together with the other team players to ensure that we support the mothers. So I want to drop to just share a quote. So for these mothers who come with a drop of milk, do we appreciate? So it is, for me, I throw a challenge to the team. Appreciate every little drop that a mother brings into the department. And if milk was to be poured, so there's a quote here: don't cry over spilled milk unless it is breast milk. And for this case, cry a lot. Yeah, this really tells us the power of breast milk. When we pour breast milk, we should really cry. That is a big loss for us. Then the other team is, the other quote is, every drop of milk is a gift and is precious and it counts. Every drop of milk is a gift and it is precious and it counts. So I don't know if we have any comments. Maybe you can check for me the comments just to see if there are any reactions. So there's a comment here. We are aware that certain circumstances cause lack of enough milk production, like a sick mother after delivery. Thank you for that. Truly speaking, we have cases where we have mothers who even end up in critical care units. So for these special cases, we have to chip in together with the support from the nutritionist. Thanks for the educative presentation. I haven't been getting, okay, that one will be sorted out. Your contribution is greatly appreciated. I appreciate your expertise, clarity, and compassion. Truly made a difference. So there's a comment here from Akinyi. Lifestyle in the urban areas can hinder the breastfeeding journey. Support the rural areas enables the breastfeeding journey. Thank you, Akinyi, for that. So when you look at the lifestyle in urban areas, there's a lot of things happening in the urban centers. And of course, that can affect it can affect the breastfeeding journey. For the rural team, remember the people in the rural areas, they live as a community. They support each other. There's that visitation and support from the mummies around, the grandmothers around, and the whole team. So there's a comment, there's a summary here from McKenna, so you can give the summary.
Okay, so in summary, we are saying that breastfeeding is the cornerstone for child survival, nutrition, and development. And then the baby-friendly hospital initiative has since been shown to positively impact breastfeeding outcome as a whole. Therefore, healthcare practitioners, hospital facilities, and policymakers play a big role in supporting breastfeeding. I guess this is a flyer that needs to be in every clinic, in every labor ward, the 10 steps. So through these interventions, they can promote, support breastfeeding outcome for both infant and the mother. So my advocacy, as I summarize, is that it's good for us to have the 10 steps in our facilities for that matter.
Thank you very much, McKenna, for the nice presentation. Once again, I truly appreciate. And there's a quote there from McKenna: "Together, let's empower mothers to help create a more breastfeeding-friendly world." So we are challenged as even in our facilities to ensure that we give mothers support in terms of having a friendly environment, having a clean environment with, of course, considering IPC, they have a hand washing section, ensure that they have the support system in place. Like for our facility, I'm proud of my facility. Our facility has a friendly environment for mothers to express and even breastfeed. And there's the support from the nutritionists who are always available, to support the mothers who have a challenge in getting milk. And again, the other thing is that we have television in place with, we have flash a USB in situ with learning materials that shows the mothers how to, the latching, how to put the baby on the breast, and how to position and all that, how to express. You realize that many mothers, when a mother delivers, we have, more so if you deliver normally and you get to a point where you have to express, sometimes it becomes a challenge. So there's the support from the nutritionist, the nurses in place, and of course, learning materials, which has really helped. Then, of course, the other thing, again, we are doing as a facility is ensuring that we have continuous sensitizations to this mother, at least thrice a week. We talk to them, and this is continuous, and we talk about breastfeeding, the challenges they are facing, techniques, positioning, and all that, and of course any other thing that may affect mothers with newborn babies. Then again, I'll say, I don't know what you're doing from your end to support these mothers. Probably I can hear from your end what you're doing in your facility that I have not mentioned, to just see what different thing you're doing in your facility that I can pick and see what has worked. How are we supporting the mothers in our facilities? I'll be glad to see the charts from your end. I can see there's Dr. Mapesa from Kakamega County. my role providing evidence-based information to the mothers. Very, very important. Thank you very much. And again, I think as a team, we need to think of ways of how to continue doing research on the same so that we keep improving and giving evidence-based statistics and improve on our care to support these little ones. So I think I want to thank the audience for your time and participation. I want to thank the presenter, Madam Kinoti, for the good presentation. I also want to take this opportunity to thank the KNH Standards Department for the support accorded. I want to appreciate KNH Medical Research Team, the Nursing Standards Team. I want to appreciate KNH Nursing Standard CPD Coordinator, Mr. Franklin Babu. And I want to appreciate and I want to believe that the information will be used and supports, it will help you even in your facilities and even help our little ones. Thank you very much and have a blessed afternoon.